classification of muscles. Here we are going to classify them in muscles classification based on the action. Based on the action, muscles are classified. So muscles types are: first one, agonist one muscle, then antagonist one muscle group, after that synergist, so these are one group, of that fixators. So these are the types of the muscles according to the muscle action. First, if we take agonist, so in this agonist muscle group, what it means, these are the prime movers of a movement. What it means, suppose if we take this is our arm and this is our forearm, this is our hand. Okay, this is the hand, forearm, arm. So if we want to do, suppose if we want to do elbow flexion, which muscle will do main elbow flexion? Here biceps muscle will be there, this muscle will do elbow flexion. So agonists are the prime movers of a movement. So the prime mover for the elbow flexion is the biceps brachii. So these agonist muscles are going to produce a movement. They are going to produce a movement. Which muscle will be helpful for that movement? Those muscles are nothing but agonist muscles. Okay. Now we'll see antagonist. So in this antagonist muscles, see, we know what is agonist. Agonist muscles are the prime movers. Of a movement. Those are agonist muscles. Antagonist muscles means the opposite group of muscles to the agonist. So these are the antagonist muscles. This what it means. Suppose one bone is here. Here, suppose these are agonist muscle. Antagonist muscle means opposite group of muscles to the agonist. Suppose if this is agonist, the opposite group of muscles which are present behind the agonist, opposite side, these are the antagonist muscles. So here these muscles are not going to resist this action. Antagonist muscles are not going to stop the action of the agonist, but still this antagonist muscle has ability to stop the agonist action. Okay. Now we'll see both agonist and antagonist. Agonist and antagonist. Agonist, antagonist, what it means? Suppose if we take arm component, this is our biceps, so this is our forearm. Here elbow joint is flexed, here elbow is flexed. So here we'll be having humerus. This is our biceps brachii muscle. Here acting as a agonist. Here triceps muscle acting as a antagonist. So what it means, if one movement is happening, both agonist and antagonist will work co-contraction. It will go for co-contraction. Co-contraction means what it means. See, if you see here, when we did agonist contraction, if we do elbow flexion, here biceps muscle will go for shortening. Nothing but concentric contraction. Triceps muscle will go for lengthening. Nothing but eccentric contraction. This is nothing but co-contraction. One muscle group will go for concentric, one muscle group will go for eccentric contraction. This co-contraction, concentric and eccentric, these two comes under isotonic contractions. So these are about agonist and antagonist. Same this co-contraction we'll see reverse. Now we'll see in reverse. Suppose from elbow flexion patient is doing elbow extension. Suppose these are arm component, this forearm component, this hand component, forearm component and arm component. These are our elbow, these are our shoulder joint. So from flexion patient did extension. What it means here, triceps muscle will work as a agonist. Here biceps muscle will work as antagonist. So here also again same co-contraction will happen. Triceps muscle will go for concentric contraction. Antagonist mean biceps muscle will go for eccentric contraction. So these are about agonist and antagonist. Now we'll see what are these. Synergists. Synergist muscles are the muscle group. It is going to helpful for the agonist. Synergist muscles are going to give assistance to the agonist group of muscles. So those are synergists. Fixator muscle group means they are going to provide stability. stability to the antagonist. So here the synergists are going to provide assistance during the movement. Synergists are going to provide the stability to the movement. These will not involve in movement. These muscles will not involve in movement. Fixator muscles will not involve in movement. It is going to just provide stability to the origin of agonist. Stability to the origin of agonist muscles. Fixators will provide, and synergists will provide assistance to the agonist muscle when they are performing, the agonist muscles are performing a movement, either flexion, extension, whatever. Okay, so this is about muscle classification. Clear?